this equipment in hospitals. It is used actually very low voltage, lower than 100 watt, and the current is around 5 milliamp. It is actually when provide this treatment, the patient can feel it is painful, and you can find the muscle contraction. So this can induce the body response, like the muscle contraction, can feel it is painful. But when you use eLife and feeling, no, why? So there's no feeling, no body response. But why you believe they can treat disease? So this is different. The eLife is different from the traditional electrical stimulation. The traditional electrical stimulation is low voltage but relatively high current. It is used the current to treat disease, to induce the body response, like the muscle response, like the nerve conduction, and also so other response like the feeling, the sensory responses, and so on. So for making diagnosis, for providing treatment. And what is eLife? eLife is from, there are several parts of this machine. So this one is electrofield generator, and then you have insulator and also an M mat, the mat with charge, with negative charges, right? And you compare this table, the data, the voltage, the current, compare with the traditional electrical stimulation is quite different. So the voltage is very, very high. It's 20 to 90 times the traditional treatment. Usually we use below 100 watt. But this starts from 1,000 or 2,000, and can be as high as 9,000, right? Very high. But you look at the current, the unit, it is a milliamp. So the range is between 0.2 to 0.9, right? Compare with the traditional stimulation, so but you can feel pain, it's painful. You can observe the muscle contraction. It starts from 1 to 5 milliamp. So this is much lower than that one. This is why you cannot feel the stimulation, even there is electrical field. So what is eLife? Now we just summarize its function as actually it has multiple names as mentioned by Stephen, like the electricity field therapy, potential therapy, static electricity therapy, and I find it is very comprehensive description as a post-electrostatic field therapy. So with abbreviations is PESF, P for post, E for electrostatic, and E and S is for electrostatic, and F for field, as post-electrostatic field therapy. Yeah, and its function is through post, because it provides 50 hertz stimulation. 50 hertz means in a minute, 50 times stimulation. So 50 very short in current stimulation. And high voltage, because the voltage between 1,000 to 9,000, very high. And it is low current because it is as low as 0.002 to 0.2 milliamp to 0.9 milliamp. And what you can feel the electrical stimulation, the current starts from 1. So with the highest level, actually the sensitivity to electrical stimulation varies from people to people. If you are very, very sensitive, so it's the highest level as 9,000. So level 9, you can feel a bit tingling. But if you are not so sensitive, I think more than 90% not so sensitive. But you feel nothing, right? Yeah. So I think the name, I like this name, is post-electrostatic field therapy because this is a comprehensive description of this method. So here I just show you several slides to show actually the physics of this method. So this is an electrostatic field. Actually, on your arm mat is with negative charge. It can be with positive or negative charge. But with this machine, actually, we're using the negative charge. And why you change the different levels? Because different level is related to this force. Okay, the here, the voltage, and the here, the force. And the here, the energy you can get. And if there is a hair force, so it can penetrate to deeper tissue, and also in our body, actually, the electro resistance of different tissue is quite different. So some tissue is quite with relatively low resistance, and some other tissue with high resistance. I'll show you later the tissue, the different electro resistance in different tissue. And the stimulator, actually, we have two types with this machine. One is a mat, right? Yes. And another one is a handheld, as what is the arm pen? Yeah, the arm pen. So one is pen, one is mat. The mat is a, so the physics for the flat, we can show with this. And what about pen? Actually, it is a ball charger. Right? Have you used the pen? Yes. Yeah. And you feel something with the pen? Yes. Tingling, right? When you touch the pen, you feel there's stimulation, right? Yeah. Yeah. Why there is difference between the mat? It's connected to the same machine. And with the pen, it's very low. Actually, you can use only very low level voltage, only 2,000. Cannot change, right? Can change? Can change to 9? No. Yeah. So, but with the pen, usually you can feel when you touch to your skin, the skin feel there is tingling, right? Yeah. It's painful. Why? You connect to the same machine and you use the lowest level, 2,000 only. But with the mat, you feel nothing. Yeah, this is because you look at this, it's actually through the ball, the area is very small. Then if you have same charge volume, then the density higher in the ball, then at the ball surface rather than on the mat surface, right? Yeah. So the current actually is higher in pen rather than in the mat. So actually what you feel is the current, the level of the current. Actually with the pen, it's with a low voltage but a high current. And it provides only treatment to a localized disease, so only local tissue. So you feel this only when you touch to your finger, only your finger can feel it, but it will not over the wrist or travel to other area, right? It's very localized feeling. So this is why with this machine, use very high voltage, just transfer all this energy to the whole body. Yeah. So this is why use very high voltage. So this is difference between the voltage and the current. And the current, with high current, you can excite the local tissue, but it cannot transfer with low voltage. It cannot transfer to very far from the stimulated tissue. So here just show some physics. Okay, now we move to the very important question. Is e-life safe? Yeah, according to your experience, it's safe. So I would like to discuss a bit about how to, so for a new medical product, actually, how can a medical product, so this can be used either in hospital or home as a home product. You know, so some medical equipment can only be used in the hospital. It cannot be used in home because the machine will be operated by people with professional knowledge, right? And some medical product, it is for home use without any professional knowledge. So how to make this decision, whether this is a hospital product or it is a home product? Actually, we consider three factors: the safety, the side effect, and the effectiveness. So any drug or device, actually we consider only these three factors, whether it can treat disease or not. If it can treat some certain disease, it has effectiveness, then it is a medical product, right? Otherwise, it is not medical product. It cannot change any health conditions, right? So this is the effectiveness. And any drug, it can has some effect. It can also have the side effect, right? So to which extent is the side effect? And also the safety, like electro stimulation. So the voltage, the current, whether this can treat the disease or result in some electro injury. So the safety. Actually, for the home product, the safety is the most important. And then consider the side effect and then the effectiveness. So usually home product is not as effective as hospital product, right? Yeah, for example, for cancer, the radiotherapy cannot be done in home. There is no home product. But so the hospital product, because it's operated by people with professional knowledge, so the effectiveness is most important thing. So it should be effective as prescribed by doctor, and like the radiotherapy, so it can kill the cancer cells, right? But it results in also side effect like hair loss, or other side effect. But it is under the monitor. Doctor can monitor it, can control this. So, and also the safety. It may not be very safe, but the doctor knows to which extent is the safety and can control and monitor this, like X-ray, right? It is actually it's not safe, but with a room and also with some protection methods, then it is relatively safe, and it's localized in the house. It's used in the hospital. It's relatively safe, but it cannot be used in home. So for medical product, actually for both the home product and the hospital product, we consider all these three things. But the importance it is for the home product, we consider first it's quite safe for any people to use it. And then the side effect, and then the effectiveness. So it is may not be as effective as in hospital. For example, eLife, perhaps you can design this machine with a more higher voltage. It might be with higher voltage, it's more effective than the product you are using, but it is no more safe for in-home. This is why the highest is to 9,000. It's already effective, but with time, right? Not just use one time, you need to use it repeatedly, and you can observe the effect in 2 weeks, in 1 month, depends on what type of disease and how severe is the disease, right? So for safety, actually there is a safety control by the government or some other professional people. The electrical product safety testing, what has been done for eLife? There are several tests. The first one is the IEC 60335. What is this? It is for this deals with the safety of electrical products for the household and similar purpose. So this is more for the household. It's not for hospital use. So eLife obtained this certificate. It is actually the safety is more important than safety in hospital. And the next one is IEC 60601. This is technical standards for safety, for both safety and effectiveness. So eLife obtains also this certificate. So with this certificate, if you don't understand why it is safe, why it is effective, but the professional people actually has tasted it for you. So with the IEC 60601, it show you both the safety and the effectiveness. And the next one is CSPR 14. This is for the electromagnetic compatibility test, because this in your home you have, in addition to eLife, you have also other electro product, right? Like your mobile phone, like TV, like other things. So all this put together, if you just go just near a TV, you may hear some noise, right? So this is electromagnetic interference, so the interaction between two machines. But this is well protected. So because the compatibility is just whether this can in the same room together with other electro product. This is also tasted. And another one is for the effectiveness. It is tasted by the U.S. Food and Drug Association. This is classified as a class 2 biofeedback device. It's a type of physical intervention device. To further explain what is the difference between the voltage and the current, and just think about, so compare the charge with water. Actually, it's the same. Both the electric charge and water is a flow, right? So the energy, it is the voltage means it's a potential. So the potential to work is from the mountain. So the difference in height between the high end and the low end. So the large is this difference. The higher is the potential, right? That's for the water and also for charges. Another thing is you find a point here anywhere as a reference point, and you observe how many water flow past this point in a second. So compare these two flow. This one, for example, in a second, past this point, 5 liters, and this one, more than that or less than that. This perhaps 500 liter, right? Although the potential, this one is higher than this one, right? So the force, actually, if you measure the force, the water drop from the high end to the low end, the force is higher than this one. But the flow, so the current, this one is much more lower than this one. If resulting in injury, which higher energy, if you calculate, this is more dangerous, right? So this is high voltage. This is E-life. High voltage and very low current. And this one is low current, low voltage, but very high current, right? Now you understand what is difference between E-life and the traditional electrical stimulation. This is the difference. So why is very high current? Because the high current drop, the water drop from the high end to low end is very high force, right? So it can penetrate to the very resistant tissue, even to bone, to others. So it's a whole body stimulation. Because the aim of this machine, it's designed for improving health. It is not for treating a specific localized disease, right? And through improving the general health, perhaps the second result, it is the consequences to treat localized disease. And this one is like the traditional electrical stimulation. It's actually the force is not very high, but the current is so with low voltage, high current, and this provide only very localized stimulation, like a single muscle stimulation or just a nerve stimulation, but it's not a whole body stimulation. So any questions? Yeah, now we talk about not the effectiveness, but the safety. The safety is so whether it is safe. What about the current? Actually, you can feel it. If you don't feel any stimulation, then it is less than less than 1 milliamp. So it is quite safe. If you feel the stimulation just with the pen, for example, so it is higher than 1 MA. So with the increased current, the feeling is the body response ranges from very slight sensation, so 1 milliamp, to as possible, so muscle contraction, and then possible heart fibrillation, and so on. And just show you the range of the relationship between the level of the current and the body reaction. And E-life is a pulse high voltage. I would like to highlight again. This is high voltage, but low current treatment. And the low current is quite safe. This is why because the electrical energy can be converted to thermal energy, and accumulation of thermal energy result in the burn injury, like in the picture, right? But this is with pulse stimulation. With pulse stimulation, there is no accumulation of the thermal energy, and also there is no continuous contraction of the muscle, the excitable tissue. Yeah, and so quite important because it's a class 2, it's not class 1 safety. So when you use it, it's better use an insulated footboard. Yeah, just like you see this bird sit here, it's quite safe because it's insulated from the earth. But the human, because the hand is with air and the food is on earth, then there is a potential, the high end and low end. and then the charge flow can pass through the body and result in burn injury. This is why there is insulated footboard. It is for safety. Okay. Now, this type of treatment, the post-electrostatic field therapy, is used actually already very widely in the world. Many used, like in Europe, used in different settings. In Europe, it is used mainly in the hospital, in sports center, in healthcare center. This is according to my investigation. And in Asia, like in Hong Kong, in Malaysia, in other countries, so mainly for home use, for beauty shop, for rehabilitation therapy. And in North America, so according to my search from the internet, the users are mainly the Oriental Hospital for improving health. So I have searched from the internet the publications just showing the evidence of the effectiveness of this treatment. And in the past around 20 years, and here I show some good designed research and report. So in different journals, you'll find actually in Russia many reports, right? But I can read only the abstract in English. I don't understand the full text. Okay, but with this publication, first you find it's used worldwide in many countries already. And this can, again, prove the safety and also the effectiveness. Otherwise, it will not be used worldwide, right? So, just share some findings with you. So this is the effectiveness. It's published in the dermatology, a journal of very famous journal of dermatology, as biological effects of this treatment this is for the hair loss, treatment for hair loss. They recruit 25 subjects. So 25 subjects, and the treatment period 36 weeks. What is control group? You know, as just sit on the mat, and the machine is not on. So you don't know that. Yeah. So this is for control. This without treatment, and the other group with treatment. After 36 weeks, then in the treatment group, the hair count increase around 66%. With the other group, no significant increase. And so this can show really the treatment is effective, right? And another study is also about the hair loss, but this is not for treatment. This is for prevention. As the women and the chemotherapy, so breast cancer and the chemotherapy, we know that it's well known with chemotherapy, this will result in hair loss. Right? So just with this treatment to test its effect on prevention of hair loss. And you find this in how many people here in the study? It's it's 19. So 13 participants, 13 women, and 12 effectively prevention of hair loss. Actually, after chemotherapy, it's 100% hair loss. But 12 effectively prevention of hair loss, only one. So this shows you its effectiveness, it's effective, but not 100%. 12 of 13 effective, but 1 no response. But this we consider it is effective because when you get a patient, you can tell the patient, so the potential of this treatment is not 100%, but it is more than 90% chance for prevention of the hair loss, right? And here just photos show this is a result as 9 months. This one, 9 months after the treatment, and this 2 months. Any difference? Yeah, from figure, and you can also count the density. Usually we assess this not qualitatively. Here show you the picture on the qualitatively. If we report it as with quantitative evaluation, then just for example, select this area, and then we measure the density, how many hairs there, count the number. And this one, yeah, and the difference, also 2 months. Okay, so another indication is a headache. And this study is using actually the headache. We cannot direct measure headache, right? The severity of headache. Then can only ask the patient with questionnaire. Then the questionnaire to ask the patient to find here 25 subjects, and effective from here, effective with good effect or perfect cure. As only 4, so no effect, and 21 effective or good effect or perfect cure. So this is why use a group to test, because the response actually they can to different level, different extent. So all effective, but with good effect, a perfect cure, or just decrease pain. This is another study on the oxygen situation. Perhaps this can explain why this can treat many different types of disease. Actually, the disease like the hair loss, like headache, all that's related to the oxygen situation of the tissue, of different type of tissue. Right? And this study just show you the oxygen situation before and after the treatment. Okay, read the level at the end of this table. This is 46,000, right? And this 64,000. This is an average measurement of a group of people. It's not from a single subject. It's from a group of people and calculate the average. So the average in this group, see here, is 46,000, and this is 64,000. It's a big difference, right? Yeah. So the oxygen situation is actually improved by using this eLife. Although you don't feel anything, any stimulation, but it can really change the oxygen situation. So when it can improve the blood circulation, can change the tissue oxygen situation. Then for the wound healing, so when there's a wound, it's an injury to the skin, there's a wound, the healing is through first the blood vessel goes into the wound, and then there's blood restoration of the blood circulation, and then the healing of the wound, right? So have you met any diabetic patient? So diabetic patient, they have problem in their blood tissue, blood vessel. And when they get any injury, like this one, it's black, this wound, right? Because the black is because there is no blood vessel there, the died of the tissue. And usually without treatment, there is no healing of this wound. This is with eLife. So see gradually the healing of the tissue. So for people without diabetes, the wound healing is within several weeks only. But for diabetic patients, it can last very long time. There is no healing. And endly, there is amputation of the leg. So now, if you meet any patient with amputation, actually 50% of them is because just caused by such a small wound, and then further infection to the whole limb, and then amputation. So 50% amputee are diabetic patients, and the other 50% traumatic. This is another, as also, actually it's a small wound and an injury, but because this is a diabetic patient, without treatment, there is no healing, and then amputation of this limb. But this, with treatment, you see gradually there's new tissue, and the color change. This is white, right? Lack of blood supply, and here, red, as ingrowth of the blood vessel. When there is new blood vessel, there is blood supply. Gradually, there is healing of this wound. But this is because there's improved blood circulation and also improved oxygenation of the tissue. And this is another case. So this study is conducted in Europe. So for diabetic foot, it is effective, as shown by this study. There is a healing of the injury, and patient, there is a decreased pain, and also evidence by the decreased use of painkiller in patients. Okay. Now with these cases, at least you can see for hair loss, for headache, for the diabetic foot. So all this related to the blood supply, the disease is quite effective, right? Post the electrostatic stimulation. Why it is effective? This is another study to study the mechanism. The study on the blood, the calcium level, because the calcium level is related to the health of the muscle, of the bone, and the heart and other tissue. Yeah, that's quite important. So this study shows such. Actually, there is this is before the treatment. It's 9, right? And the level after the treatment, immediately after 20 minutes treatment, is 9.5, slightly increase in the calcium. Okay, here is a summary of the result. A group average. Again, this is from a group of people and calculate the average. This is before the treatment is 9.5, and after the static field stimulation is a 9.9, slightly increase, right? So anyway, this show you don't feel any stimulation, but this changes the calcium level in your blood. And I'm doing a study on the effect of this treatment on improving the recovery of post-stroke patient. You know what is stroke? A patient with hypertension and suddenly paralyzed of the limbs. So the arm, the leg cannot walk, cannot move, the arm cannot move. It's because there's either there's an embolism in the blood vessel in the brain, or there's bleeding in the brain because of long time hypertension. So after stroke, the patient will enter rehabilitation. It lasts for a long time. They can walk again, they can move, but usually there's some disability, residual disability, so can move, but not that good. And so because this is also related to the blood circulation, to the oxygenation of the tissue, so we just taste the effect of this treatment in patient 4 weeks after stroke. Because within 4 weeks, usually they are in the ICU, intensive care unit. They cannot do any rehabilitation. Then we divide the patient in 2 groups. A group is daily 30 minutes with this treatment at the level 7 or level 9, and the other group without any. The machine is off, not on. Then 4 weeks, only 4 weeks time. So we test the movement ability of the patient. So first, actually we planned to complete this research this in Stephen time was our original plan. I remember us in April, right? Yeah, the original plan was in April. We can complete because only 24 patients. It's quite easy but up to now we have not yet completed this product because in the control group, the patient come to treatment for 2 or 3 times, and then they will not come again. Yeah, because there's no effect. No, so the dropout rate is very high. We have already actually for the treatment group we have completed. Because the patient they come again and again, and then we can provide successfully 28 days treatment, and then evaluate the final report, the result. But the other group, the patient come a week, and they will not come. Then we need to recruit new subjects. So I think we can complete this. So by end of October. So because of the very high, the dropout rate actually already show the effectiveness, right, of the treatment group. So we compare the final outcome, the walking ability and also movement of the arm and the language and so on. So in treatment group, significantly improved when compared with the other group of patient. And also, we measure the tissue. We use an infrared machine to detect the brain, the tissue oxygen level. So in the control group, it's around 70%. So 70% normal tissue, it is more than 85%. But in the injured tissue, so there's only around 70%. In post-stroke patient, this is why the rehabilitation lasts very long time, because there is a lack of oxygen in the brain area, the injured area, so the healing lasts very long time. But in the other group with this treatment, daily 30 minutes, the level between 7 and 9. So the oxygen situation is between 82 to 90 something, but on average it is around 23% higher than the control group. And this can explain why their movement ability restored more faster than in the control group because of the high oxygen situation. And this provide evidence that this machine actually it can elevate the oxygen situation in the brain tissue. And what is the difference? 23% is when you live in Malaysia or you go to Tibet. So Tibet is very high and very few oxygen, right? So if you go to Tibet, then the oxygen situation in your brain has decreased around 20%. So your response will be very slow, and you'll have headache. Yeah. So this is because of lack of the low oxygen situation. So after stroke, actually, the oxygen situation dropped also around 20%. But with this treatment, it can again elevate it to a normal level. So this is an evidence. Again, it can be effectively used to treat the stroke patient. There are many water molecules. When there's a negative charged, and sit on the negatively charged mat, then there's a rotation of the water molecule. So if this is a negatively charged direction, then this will rotate counterclockwise, right? And this is post-electrical stimulation. So 1 second, 50 times. Just on and off, on and off. And what about the water molecule? They rotate clockwise, counterclockwise. And it's on, then to direction, so the positive charge side is to the counterclockwise rotation. And off, then rotate back, right? So this is why we see there is a macro vibration to the body. As the water molecule rotate clockwise, counterclockwise, 50 hertz. The rhythm is 50 hertz. It's because of the on and off stimulation of the electric field. So you feel nothing, but in your body when you sit on the mat, then rotate of these hands. And do you think there is an energy consumption with this molecule movement? Right? And also, so in addition to the water, it is positively and negatively charged, and also our cell, the membrane. So one side, the outside, the inner side is charged positively and negatively, and this will also affected by the electric field. And for example, the red blood cells in aging people, so the red blood cells, they contact with each other, and this decreases the body surface, the cell surface, right? Actually, the oxygen combined to the red blood cell is just on the surface. The surface area decreased, then decreased the ability to carry the oxygen to tissue, right? Yeah. So when you sit on the mat, then this will change the alignment of the cells because it's charged positively and negatively, and then it will separate from each other. Then this increase first the area for carrying oxygen combined with oxygen, then increase oxygen in your blood. And also when they separate, so the volume of each cell decreased, then they can move into the very small blood vessel. Then this can improve the blood circulation. This is why it can accelerate the wound healing or improve the wound healing ability. So now I'm just trying to answer the question why this treatment, E-Life, can improve your health. That's the first So our body is formed 50% as the content water, as body water, right? And this field can affect the water, and then with this 50 hertz stimulation, so the water molecule rotate. So this study showed evidence that resting metabolic rate increased when you sit. So it's increased by this treatment, by the post-electrostatic field therapy, the PESF. To which extent can it increase the metabolic? The difference. So this is individual subject. The subject number, the age, body weight, and so on. And then we just look at the difference. There's after and prior to the treatment, before and after the treatment, the metabolic rate measured has increased 70. So all are positive numbers, right? So all increased in different ranges from, so 1 is 0, no effect, no change. And then the other range from 74 to the highest, more than 700. Anyway, there is no decrease, so all increased. And on average, so we just calculate the sum, and then the average is here by the start. So the difference is around 700, 1800. The difference is increase the metabolism. I think this is related to the molecule rotate, because this will result in the energy consumption. So the increased metabolic rate is important for us. Why? Yeah, we look at this, the lifestyles and healthy aging. So 20 years ago, I don't think this machine will be so popular, because 20 years ago, the main problem, the risk for our health, it is a threat for our health. It's not the metabolic problem, as the low nutrition, lack of nutrition, right? And also the insufficient nutrition result in early death, and also infectious disease. So 20 years ago, do you know what is the life expectancy in Malaysia? I just searched from the internet this morning. Yeah. 20 years ago, you know what is the average life expectancy in Malaysia? 45 years old only. So on average, because when there's infectious disease, so many people die from infectious disease, perhaps very young, and also insufficient nutrition, so poor health care conditions, and so on. So the life expectancy is very short. So there is no aging problem, right? But you see the fast development of this country, and also the health care, the improvement in the health care condition in hospitals, service, and so on. Now the life expectancy, so for male, more than 70 years old, 71, so increase 25 years, and also for women, 76 years old. In Hong Kong, the women that live the longest. Now on average in Hong Kong, the women that live 87 years. Yeah. So the aging is a big problem. You want to have a healthy aging, right? Not live very long, but it's suffering from many diseases. So the improvement, the health improvement now is a quite important issue. I think this is why so many medical devices are designed for improving health, and e-life is one of them. And this can become popular. This is because we feel so not well, then just use it to improve your health, and you want also prevent many diseases to have a healthy, long life. And also the lifestyle changes in these years, right? You have car? Yeah, just ask whose car was there. So if you drive car, then you walk fewer than previously, right?
Yes.
Yeah. And you watch TV? How many hours? How many hours a day? At least 2 hours after dinner? So no further movement. Just sit there and watch TV. And you work in office? Yeah, many office ladies here, right? How long time you sit in front of a computer without any movement? Many hours. So how many movement you have every day? So compare with people live 20 years ago, there is a decreased movement and increased eating, right? So more eating, less exercise. This is our lifestyle. And now we find many people very fat, overweighted, because take a lot and no movement. And so the e-life, it can rotate the water molecule and result in more energy consumption. So it can replace a part of your exercise, right? And it can improve the blood circulation. It can improve the oxygen saturation in tissue. So this can improve the health. And also, so for people, this is quite important. And now the disease pattern, so instead of the infectious disease, now the people suffering more from the cardiovascular diseases. Like you hear many people that have hypertension when they reach 40 years old, right? So, and diabetic patient, because take more and less exercise. And also overweighted. Yeah, all this is affect your health, and with e-life it can improve these conditions. So here just a summary with evidence from the different research team show evidence. The electrostatic field therapy, it can treat successfully used for these diseases, like the other diseases like the high blood pressure. Actually, this can also decrease the blood viscosity. You can taste it. I taste in my home. It's just before turn on the machine, I measure my blood pressure, and also I measure blood pressure immediately after I turn off the machine. So there is 20 difference. It's around 20 you can measure. I think this is repeatable because this can immediately change the alignment of the water molecule and also the red blood the red blood cells, and this change the blood viscosity, so decrease the resistance of the fluid and decrease the blood pressure. But this is only a temporary change. It lasts not quite long, so perhaps only 1 hour. But this shows you the evidence. This is an evidence that it really works. And other disease like diabetic disease, and so the blood sugar level, this can really decrease the blood sugar level. And also healing, improve the healing of the diabetic ulcer. Like osteoporosis, because this can increase the calcium level in the blood, and also help obesity problem, the overweighted, because this can increase the metabolic rate. And like the stress illness, actually many of them related to the low oxygen level of the tissue, have headache, feel not well. And this can improve, this can increase the ability of the red blood cells to carry the oxygen